I welcome you to another section of our class. This is Module 4 under the course Mental Health Management. And for this module, we'll be treating common mental health condition. So we'll be looking at different mental health conditions that we all can easily relate to. We'll be looking at the causes and all. And for the course, we have the contents of the module to be one, we have anxiety and depression as one of the common mental health issues. Causes of depression. After we are done with that, we'll move to the psychotic disorders. We'll also look at the causes of psychotic disorders, then move to the symptoms of psychotic disorders also. We'll also be addressing the different types of psychotic disorders. Now after that, we'll move on to physical disorder. Whereby we'll look at, under physical disorder, we'll be looking at the types of physical disorders, symptoms of physical disorders, causes of physical disorders, and the prevention strategies for common mental health conditions. So these are the areas that we'll be addressing in this module. You have the introductory part to be that when we are talking about mental health, it encompasses emotional, psychological, and social well-being, influencing how individuals think, how they think, how they feel, and also how they act. So it's common mental health conditions like we've mentioned in the module, like anxiety disorders, depression, psychotic disorders, and personality disorders. All these common mental health conditions, they significantly impact lives in one way or the other. So let's take anxiety disorders for instance. It involves excessive fear or worry, while depression causes persistent sadness. Psychotic disorders, it distorts reality, and personality disorders affect interpersonal functioning. Risk factors include of all these mental health conditions. It includes biological vulnerabilities, environmental stressors, and psychological traits. So let's move on to the next to the main contents of the module. And we said we'll be looking at these mental health conditions one after the other. So we are starting with anxiety first, and we'll be looking at what anxiety implies, what it means. So it means that anxiety disorder cover a range of mental health issues where people deal with over the top fear, worry, or unease that is way bigger than the real situations call for. In short, it has to do with mental issues whereby people deal with more issue or more worry than the normal that is more bigger or way bigger than the normal situation that is on ground. So this is not the short-lived nerves you might feel before a big event like an exam or a first date. These feelings hang on and throw off normal routines. For example, let's take an example now. Let's look at an example of this. Generalized anxiety disorder has you stressing non-stop about regular things. Panic disorder brings on unexpected intense episodes. Social anxiety turns social situations into nightmares. In the sense that where there is any social gathering or social relations or situations, it turns something like this into a worst nightmare. And phobias zero in on strong fears of particular items like elevators or animals. We also have phobias are one under the anxiety that we are looking at, whereby we have there is strong fears of a particular thing or a particular item, which could be an animal. We can have phobia for a particular animal, phobia for heights, it could be phobia for elevators and the likes. So the roots of anxiety disorder mix up genetics, biology, surroundings, and personal thinking styles. If family members have had it, the chances go up because of passed down factors that tweak brain chemicals. So especially one like serotonin and GABA that handle emotions and tensions. So let's move on to the next topic that we'll be looking at under this module is depression. Depression, as it is defined in scholarly literature, it is a prevalent mood a prevalent mood disorder, sorry, that is characterized by persistent feelings of sadness, emptiness, or irritability, accompanied by somatic and cognitive changes that significantly impair an individual's ability to function in daily life. Just like we are used to the word depression, so person is going to depression, he's depressed, he has done this, he's depressed, something happened to him, so therefore he's depressed. So this, we can easily deduce meaning from this sorry, the meaning of depression from this statement, because it's a common statement, and it is said that it is just like a prevalent mood disorder that is majorly featured by feelings of sadness, emptiness, failure, irritability, and the likes, uh, on individuals' ability to function, and on individuals' ability, you just become sad and all of a sudden try feeling empty deep down. These are symptoms or signs of depression. So according to American Psychiatric Associations, Diagnostic and Statistical Manual of Mental Disorders, the most common form requires, according to them, they believe that the most common form requires at least 5 symptoms persisting for 2 weeks or more, including depressed mood, loss of interest or pleasure in activities, changes in appetite or weight, sleep disturbances, psychomotor agitation or retardation, fatigue, feelings of worthiness and the likes, and recurrent thoughts of death or suicide. These are the major symptoms that we can easily trace when we are talking about depression. So let's move on to the causes of depression now. So we believe that what causes major depressive disorder is a wide combo of body biology, genes, life hits, and headspace factors. Gene wise now, if it is in your family tree, the odds jump with about 40% chances it is inherited, but no one gene caused the shot. So now depression, particularly major depressive disorder, doesn't stem from a single source, but rather arises from a complex interplay of factors that can vary from person to person. We have experts that they agree that it is often a combination of biological vulnerabilities, life circumstances, and personal traits that contributes to its onset. Where we have some experts they believe in that, and we have some that states that biological and genetic factors both play a significant role in predisposing individuals to depression. We also have imbalances in neurotransmitter chemical messengers in the brain, such as serotonin, dopamine, and the likes, can disrupt mood regulation, leading to persistent low feelings. So these are the major causes that we can easily trace when we are talking about depression. So now let's move to the next topic, which is psychotic disorders. So now, what do we mean by psychotic disorder? They are a group of mental health conditions that is characterized by a disconnection from reality, often involving hallucinations, delusions, disorganized thinking, and impaired functioning. So we have the most common psychotic disorder is schizophrenia, but other conditions like schizoaffective disorder and brief psychotic disorder, they also fall under this category, and symptoms can severely impact daily life, relationship, and overall well-being of individuals. So let's look at the causes of psychotic disorders now. Psychotic disorder often results from a mix of biological, environmental, when there is mix of biological, environmental, and psychological factors. Biological factors include genetics, which this is also, you can see that most of these mental health conditions can be caused through genetics, most of them actually. So we have genetics and neurochemical imbalances as the biological factors to the causes of psychotic disorder. So environmental stressors like trauma, substance use, e.g. cannabis and the likes, and social isolation can also trigger or even worsen the symptoms. And the risk factors also include the family history of psychotic disorders and prenatal or birth complications affecting brain development. And now we'll be moving on to the symptoms of psychotic disorder. What are the symptoms, the major symptoms of psychotic disorders? Just like we have in We have addressed that in depression and all. So we have hallucinations. The hallucination is as to seeing, hearing, or sensing things that others don't. And we have delusions. This is fixed false beliefs despite evidence to the contrary. An example of that is paranoia and etc. We also have another symptoms of psychotic disorder is disorganized thinking or speech. When there is difficulty in organizing thoughts, speaking coherently, or staying on topic, sorry. And the fourth one is disorganized or abnormal behavior. That's when there is odd behavior and unpredictable actions or reduced functioning. 5, we have negative symptoms. This has to do with reduced emotions, motivation, social withdrawal, e.g., flights, affects, apathy, and the likes. So let's look at the types of psychotic disorders now. We have schizophrenia, we have schizoaffective disorder, we have brief psychotic disorder, we have schizophreniform disorder, there is delusional disorder, we have substance or medication induced psychotic disorder, and the likes. So schizophrenia refers to persistent psychotic symptoms, just like we have given instances initially, where we have hallucinations, delusions, disorganized thinking, which all these can all definitely impact functioning. While on the other hand, we have schizoaffective disorder. This has to do with psychotic symptoms plus mood plus the addition of mood disorder symptoms, and something we have depression and mania. We also have brief psychotic disorder. That's like a short-term psychotic episode it could be under 1 month, and this is often triggered by stress. We also have additionally we have schizophreniform disorder, and symptoms include schizophrenia, but duration is shorter. It could be 1 to 6 months. We also have delusional disorder. That is has to do with persistent delusions. An example of that is paranoia without prominent hallucinations. Then the last one, we have substance or medication induced psychotic disorder. This is relatable, where we have psychotic symptoms due to substance that is used, e.g., we have cannabis and amphetamines. So now we're moving on to the physical disorder. In everyday terms, a physical disorder is simply any condition that affects the body's normal functioning, making it hard for someone to move, to feel, or perform their daily activities without pain or limitation or constraint. Now think of it like a glitch. Yes, let's think of it like a glitch in the body's hardware. Something like a broken bone, chronic back pain, or even a persistent cough that won't go away from a scholarly perspective. A physical disorder is therefore defined in medical literature as a pathological alteration in the structure or function of the body that leads to impairment, often classified under frameworks like the International Classification of Disease (ICD) by the WHO, that is the World Health Organization. So let's look at the types of physical disorders. Now we have different types of physical disorders, and they include physical disorders, neurological disorders, cardiovascular disorders, and endocrine disorders. Now, physical disorder, let's take it one after the other. The physical disorder can be categorized into musculoskeletal types, which affects the bones, the muscle, and joints, and the likes. While neurological disorders, they form another major type by impacting the brain, spinal cord, and nerves, including epilepsy, multiple sclerosis, and the likes. So we also be looking at cardiovascular disorders, and this is a type of physical disorder that targets the heart and blood vessels, encompassing hypertension, coronary artery disease, and heart failure. Sorry about that. Then the fourth one, the last one, is endocrine disorders. It involves hormonal. It involves hormonal. It involves hormone imbalances like diabetes, mellitus, or thyroid issues such as hypothyroidism. Now let's look at the symptoms of physical disorders. Now we have different symptoms of physical disorders, and they often manifest as persistent pain, which can also range from sharp stabs in conditions like kidney stones to dull aches in fibromyalgia. Now, mobility issues are also the common symptoms, which include stiffness, weakness, or tremors that hinder movement. That is, the hindering of the body in making some kind of movements that is necessary. So we also have gastrointestinal symptoms, which include nausea, vomiting, diarrhea, or abdominal pain, common in disorders like irritable bowel syndromes, IBS. So now let's look at the causes of physical disorders now. Don't forget, just like the previous mental health condition that we've been treating in this module, physical disorders, one of the primary cause of physical disorder is also the genetic factors, in the sense that they are a primary cause of many physical disorders, where inherited mutations predispose individuals to conditions like cystic fibrosis or Huntington disease. And apart from genetic factors, which is the primary and the major cause, we also have environmental exposures, which they also contribute significantly. It includes toxins, pollutants, or radiation that damage tissues over time. Infections from bacteria, also viruses or parasites, can also trigger physical disorders such as Lyme disease from tick bites causing joint inflammation, or HIV leading to immune system breakdown. Now let's look at the prevention strategies for common mental health conditions. In order to prevent mental health conditions, there are some kind of strategies that need to be put in place. So therefore, we'll be looking at preventing mental health conditions. It involves a multifaceted approach that addresses various risk factors and promotes well-being. One is early childhood interventions. We also have school-based programs, workplace wellness initiatives, and the likes. So implementing programs that focus on early childhood, that's explanation under early childhood interventions. So whereby when there is implementation of programs that mainly focuses on early childhood development, this can significantly reduce the risk of mental health issues later in life. School-based program also, when schools provide an ideal setting for mental health promotion and preventions, this can also prevent mental health conditions. And that's orientating the young ones from school. Now, workplace wellness initiative. Workplaces can also play a crucial role in preventing mental health problems by promoting a supportive and healthy work environment for employees and workers. So in conclusion, mental health conditions like anxiety disorders, depression, and the likes, significantly impact lives in one way or the other, and mostly it is negatively if it is not well prevented and monitored and managed. So understanding the causes, which could be biological, environmental, or psychological, the symptoms, understanding the causes, the symptoms, and types, it helps to guide prevention and treatment strategies like